We all know how a friendly smile with gleaming white teeth can be very attractive, but what happens when you have poor oral health? Poor oral health can lead to some serious problems with your heart and your brain. And here to tell us more is Dr. Alexander Ling. He is the owner of Parkway Modern Dentistry in Jersey Village, a suburb of Houston. He also studied at the University of Texas Health Science Center, San Antonio School of Dentistry. Thank you so much for being with us.
Well, Mary, thank you so much for having me, and I look forward to talking a little bit more about the oral mouth and systemic connection as it relates to the
Okay,
body. So thank you.
so first, how did you get the nickname Dr. Smiling? I love.
Well, Mary, it's because it's one of those things that came out of necessity. It was very hard for a lot of my patients to remember my name, so I was getting a lot of mispronunciations or misremembered attempts at my name. So I just thought about it one day, like with Ling, there's a lot of different things you can do with that as a name. So I presented myself to a patient one day. Hey, it's Ling, like smiling. I always got a friendly chuckle out of it. And ever since then, that's just a way for me to connect with my patients, to kind of break the tension and a good method for them to recall my name.
Okay, so let's talk about this connection between oral health and your brain and your heart. What happens if you do neglect your oral health? Tell me about some of those serious things.
Yeah, when it comes to oral health, what people tend to not realize, or they don't really make that connection instinctually, is that your teeth are a part of your mouth, your gums are a part of your jaw, and the
Mhm.
jaw is residing where? Inside your skull, inside your head, right? There's a very, very direct pathway between the health of the mouth as it relates to the rest of the body. So you mentioned something about infections of the brain. Infections of the mouth can retroactively make its way to the brain. So a dental infection can very seriously produce an infection that can travel to the brain. Other things that they've actually found via direct correlations and causation is that if you have gum disease can lead to gum disease is actually an inflammatory process, right?
Mhm.
Similar to
Mhm.
diabetes, similar to other autoimmune disorders. You have inflammation in the mouth that can translate into, and they've proven this, lower birth weight when it comes to pregnant women. It's been shown to
Wow.
correlate directly to infections of the heart because what starts here can make its way to the rest of the body. So the mouth is the gateway to the rest of the body, and the studies are increasingly showing just how important it is to have a healthy mouth as it relates to overall uh, systemic health.
Okay, so I know people I will who have not gone to the dentist since the pandemic. They sort of got out of it, pandemic
Hmm.
hit, and they just never got around to finding another dentist or going somewhere.
Hmm.
Or they don't, their teeth look pretty good. They don't have any cavities, so they just don't go.
Hmm.
What happens if we don't do that twice a year cleaning and those exams?
Well, and that's the thing about dentistry that's very interesting. Everyone has teeth, and problems with teeth, they can tend to be very insidious. You don't know that you have a problem until you go get a checkup. A lot of the infections and cavities that can occur within the mouth, you may never know because it's so progressive that there's a
Mhm.
problem. And by the time that the problem reveals itself, usually it's pretty funny. Like people will say, "Hey doc, they'll come see me for an emergency exam." They'll say like, "This tooth is chipped," and it was usually eating the softest thing you can imagine. Almost always like cotton candy or it's bubble gum. Uh, what led to that happening was not the direct cause. The direct cause is not the food. It's actually a progressive process that's been happening over the course of years. So when you're not consistent with those follow-ups, with those checkups, you may find that you have a lot bigger problems that you had no idea were actually there. So it is very important for that reason, so that you have someone who can look inside your mouth and determine that there is a problem that you can then treat before it becomes something more.
Okay, so tell me, how can consumers best choose a dentist?
I always look for people who are consistently keeping up to date.
Mhm.
Dentistry is a very fast evolving field. There are certain things that change, I would say, month to month when it comes to dentistry. So when you're looking for a dentist with good credentials, it's not just where they went to school, what year they graduated, but anyone who's pursued advanced education, continuing education, staying up to date with the current trends in dentistry I think that's something that's going to be important criteria for anyone to look for when they're trying to find a good dentist. And ultimately, and this is more of a personal bit of advice, try to find dentists who care about what they do. And you usually can find those who have, you can find those type of dentists when you look at the reviews for a
Hmm.
practice. If you can
Hmm.
find that they mention addressing dental anxiety, if they have a good chairside manner, these are important criteria, I think, for the patient themselves. You want to you want a dentist who really cares deeply about the person.
What's the best way to keep those pearly whites white? The everyday hygiene.
Brush twice a day, floss at
Okay.
least once a day. Do visit your dentist at least 2 times a year. Other things, if you're drinking coffee, not to say that you can't, may consider using a straw, bypass the teeth altogether, right? That's a nice way
Oh,
of, and
wow. Oh,
this is
so you
not
don't
just
stain them.
exactly not just true for coffee, but just anything that has pigment in it. If you use a straw, you can bypass the teeth, prevent that pigment from staining the teeth.
Red wine?
Also true, right? So not to say that maybe it's a bit of a unconventional thing to do. But if you are going to be drinking red wine and you don't want to use a straw, you can always rinse out with some water or chase it with some water. That's
Okay.
another way of preventing the pigment from attaching to the teeth.
And I think you said earlier, don't brush your teeth until 30 minutes after you eat, which I didn't realize that. Why is that important?
I'm glad you brought that up. So whenever you have any type of intake of food, anything that has carbohydrates in it, it doesn't just become food for you, but any residual on the teeth becomes food for the bacteria which comprises up the environment within the mouth. So bacteria will take in the carbohydrates. They'll produce an acid as a byproduct, and that happens within the first minute of ingesting any kind of food, right?
Okay.
So the softest that your teeth will be, the most susceptible that your teeth will be actually in those first 30 minutes until your saliva actually equalizes out the acidity, balances it out.
Okay, so as we age, things change. I mean,
Mhm.
gums start receding, crowns get old and crack. I mean, what are certain things seniors can do to keep from, getting dentures in their old age? I mean, are there things, you know what I'm saying? I mean, is
I
it just
do.
inevitable that old people are going to have, gums that recede or what?
So there always will be a level of recession that will occur with the passing of time. That's just one of the joys of getting older, right?
Okay.
The way that you help offset that is by being consistent with your checkups to the dentist. There's only so much that we can do, right? Everyone has teeth, which means at some point everybody will need a dentist. So the more consistent you are with your cleanings and your follow-ups, with professional grade cleanings, you're able to clean not just what's above the gum, which is something that patients are experts at. You can also clean what's below, which is where gum disease happens. Gum disease occurs below the gum level,
Okay.
right? Which a professional can help you with, whether that be your dentist or your hygienist. For
Okay.
most patients, you will always usually benefit more from an electric brush versus a manual.
How old should a baby be when the parents start brushing their little teeth?
As soon as those teeth come in, usually around 5 to 6 months is where you start seeing the eruption of those lower teeth. The
Right.
second that they're in the mouth, great time to get started when it comes to brushing.
Dr. Ling, let's shift gears a little bit and talk about your backstory. I know that your parents were immigrants to this country. Where did they come from? And how did that whole immigrant experience influence you?
So my parents were both immigrants. They immigrated here when they were teenagers, and so my
From,
immigrant one my father from China, my mother from Vietnam. They're both
okay,
Chinese. However, they immigrated from two different countries, and when they immigrated here to the States, they actually met here when they were teenagers, right?
okay.
So my story is an immigrant story, meaning my parents met here, they fell in love, got married, and then started a family, right? My grandparents helped raise me growing up because, again, immigrant story. There was not a lot to our financial when it came to our financial background. So my parents,
Mhm.
being that they were working age, they did a lot to support the family. So my grandparents actually helped rear me from childhood all the way through high school. Growing up in that type of environments, it was very unique in that my grandparents, they did their best to navigate the culture. I grew up with English being my second language, The
Okay.
home language actually turned out to be Cantonese, which is a dialect of Chinese, right? And then
Okay.
as I started in American schools, that's when I started picking up English, and now that's just the predominant language for both myself and my younger brothers as well. So, kind of going through that, there was this really big appreciation for work ethic, right? I
Hmm.
knew my
Hmm.
parents would work these long hours to help support the family, and both of my grandparents were educators as well. My grandmother was a principal of an elementary school when she was in
Hmm.
China, and my
Hmm.
grandfather,
Wow.
these are my paternal grandparents, he was a professor when he was in China in
Okay.
electrical engineering. So there was this really strong idea of there was an opportunity here in America,
Uh-huh.
and you can obtain it if you just put in enough effort and time. And pursuing education was the way to really show.
What's the biggest challenge for you on the business side of dentistry?
And I think the challenge is at the heart of it, you need to be good at talking to people. Can you manage a team? Can you guide everyone in a common direction? Can you build a culture
Hmm.
that is, revolving around, for example, people first? Can you are you is that skill set inherent or can that be learned? So I think the hardest thing is just changing gears. I can do a filling, Mary. I can do place an implants. I can strain your teeth, but when you're talking about running a business, that is not the most important skill that will determine your success or not.
Okay.
Can you lead a group of people in the same direction and follow the same goal, right? So that's been the biggest challenge, but also the biggest joy.
That's wonderful. Well, thank you so much for your time talking about dentistry and wish you the very best of luck in your business.
I really appreciate everything that you do for the Asian American community and how you continue to support the viewpoints of those who were raised in this wonderful culture. So thank you so much for your time and have a great day.
Thank you. If you
Okay.
enjoyed this video, please click the like button below and be sure to subscribe to this channel so you never miss an episode. I'm Mary Sitch. Thanks so much for watching, and I'll see you again in the next video.